Hi, everyone. Thank you for joining me tonight. I want to explain to you a new program we're starting at the agency, and it's targeted for the treatment of intergenerational trauma. And this is just an introduction tonight, but we're going to focus the program on, as I said, intergenerational trauma using ACT, which is acceptance and commitment therapy. The purpose of this training, and this is the beginning of the training, is to introduce you to ACT and undertake this potential new approach that we may be using at the agency based on the results of this particular research. So this is an introduction to you, to orient you to the program, and there will be additional training. It's planned that there will be 6 hours of training in 2 hour increments, and that'll be provided over the next month and a half. This program was started by formulating a research question. And the research question, as you can see on the screen, is in a community health clinic, which we are, serving low-income patients, how does acceptance and commitment therapy for trauma compare to treatment as usual for patients treated for intergenerational trauma? And that's the program we're putting together that you will be a part of to answer this research question. So the process will be to identify patients that are suffering from intergenerational trauma. And we're going to do that through our intake process, which we have in place now. I think most of you are familiar with the initial consultation process when we get new clients into the clinic, and there's an extensive interview process where we can assess at that point for intergenerational trauma and identify those patients who might be well suited for this program. As we do identify them, we will ask them to sign an agreement if they want to be a part of this research study. So that will be the informed consent. And then we'll select the therapist after the training is completed that will be participating in this initial study to see if this is a viable process that we can use going forward at the agency. So the plan here is essentially 4 steps. We're going to provide training to all new trainees, which you all are. And then we're going to select the 10 trainees to work with patients identified as suffering from intergenerational trauma. And those therapists will be supervised by an ACT therapist, and they will provide, the trainees will provide 15 sessions of ACT under supervision to those identified patients. And then we're going to compare that to treatment as usual with 10 trainees providing treatment as usual to another group of patients. So we intend to have 10 patients in each group with 15 sessions each. And at the end of those 15 sessions, then the results will be compared. So in ACT, which may be new to all of you, I'm going to give you a brief introduction to that tonight, and then the follow-up training will go in much more detail. So by the end of the training that you hopefully will feel confident that you can provide this type of treatment to the identified patients. So in broad strokes, the goal of acceptance and commitment therapy, or ACT, is to increase psychological flexibility. Now, Stephen Hayes, out of the University of Nevada, he was one of the founders of ACT, and he defines psychological flexibility as contact with the present moment as a conscious human being, fully and without needless defense, as it is and not what it says it is, and persisting with or changing a behavior in the service of chosen values. So essentially, simply stated, that means you would be aware of the present moment and you would take action based on your values. So this is the psychological flexibility model as put together by Stephen Hayes. And essentially there are 6 components: um, present moment awareness, values, committed action, self as context, um, which means that you can kind of step out of yourself and see yourself for what you're doing and understand what you're doing. Diffusion is when you are fused um, with your thoughts. That would be part of psychological inflexibility. So the goal is diffusion. And then acceptance. Um, so to explain that in a little more detail, these 6 core processes and psychological flexibility one would be acceptance. And psychological inflexibility is experiential avoidance. So we know a lot of our patients avoid, what they think are painful things rather than accepting and then moving forward based on their values. The second core process is present awareness, and that's contrasted with dominance of the conceptualized past. And that might present itself as just being stuck, right? Unable to act on your values. So if you know your values, that would be another core process. Then you can decide if what you're doing is moving you towards your values or is it moving you away from your values. So a lack of value awareness doesn't give you that opportunity, of course, and that would be psychological inflexibility. The next core process is committed action. That's when you take action and make that decision. Is this moving me towards my values or away from my values? And that is contrasted with unworkable action, which is a sign of psychological inflexibility. And the next core process is self as context. And we can contrast that with attachment to what's called the conceptualized self, meaning I'm sure you've heard patients say, that's just the way I am, right? That there's just this attachment to whatever is going on in them, internalized to them, or their private thoughts is just the way they are, rather than having this ability to kind of step back and examine their thoughts and accept their thoughts as just thoughts. We have thousands of thoughts a day, and we value some and overvalue some, undervalue others, and don't pay attention to most. And then the last core process is diffusion. Diffusion is like the opposite of cognitive fusion. That should say cognitive fusion, not cognitive diffusion. Cognitive fusion is when your thoughts are just stuck to you like Velcro, right? And that just becomes your reality. But if you have this ability to kind of step back and look at your thoughts and just say to yourself, I'm having a thought that, whatever that thought is, then that would be a move towards diffusion. And I'll say more about that in a moment. So, to summarize, the 6 core pathological processes or psychological inflexibility would be characterized as experiential avoidance, dominance of the conceptualized past, a lack of values clarity, unworkable action, attachment to the conceptualized self, and cognitive fusion. Now, in ACT, acceptance and commitment therapy, it's called a third wave therapy, meaning, it's the first wave was behavioral therapy, The second wave was cognitive therapy. And of course, cognitive and behavioral therapy were grouped together as cognitive behavioral therapy by Aaron Beck and others. And then the third wave is considered cognitive and behavioral and mindfulness. So, theories like DBT, mindfulness-based cognitive behavioral therapy, those are all considered third wave therapies. And that's what we're dealing with here. So there is an underlying theory called relational frame theory. It's a theory of language that kind of underlies ACT and is the foundation for ACT. So, that's really beyond the scope of this training to go into that kind of philosophical foundation. But it has all to do with language that basically it's saying that we get caught up in our language and then we try to solve our problems through language, which even makes it worse. So we take control strategies to try to control our thoughts, which it's like saying, don't think of a chocolate chip cookie. And of course, you're going to think of a chocolate chip cookie. So in ACT, there's a lot of metaphors that can be used. And I've just listed some of the more common metaphors used in ACT, like passengers on a bus, the problem-solving machine, chessboard, struggling in quicksand. And I'm not going to go through all of these, time doesn't permit, but just to give you an idea, passengers on a bus is, you would say to the patient, let's just think about it this way. Let's think that you're the bus driver, right? You just started your route and you're supposed to go to the train station. And you're going down the street and you start picking up passengers. There's a few passengers at the first bus stop and more passengers at the second and so on. And pretty soon you have a bus pretty much full of passengers. And you're going on your route and you're going with your destination to the train station. But all these passengers become unruly. And then they start telling you, I want to go to Fifth Avenue, or I want to go to First Street, or I want to go to Elm Street, or just stop the bus. I want to get off here. Or, you're driving too fast. You're driving too slow. You should have made a left. You should have made a right. Why did you not? Why did you stop at that light? Et cetera, et cetera. And the purpose of this metaphor, as you might can imagine, if the patient is the driver, he's driving the bus, and the train station is the metaphor for the value. He's driving the bus towards his value. He's taking committed action. But he's having all these unruly thoughts as he's moving towards the train station, his ultimate value. And so that encompasses, one of the core processes of acceptance, that you accept that we have all these kind of contrary thoughts that can take us away from what we value if we pay attention to them. And, that can help a client diffuse from their thoughts, not let these thoughts get fused to them and stuck to them like Velcro. So that's just an example of one metaphor that's used to kind of help clients understand this form of therapy and help them start moving away from those thoughts and just seeing thoughts as a thought. So I'll talk about some other ways that we do that as well. These are some other helpful interventions. Dropping anchor is a 3-part intervention that you can use to help a patient ground themselves, be aware of their body, and also be aware of their thoughts, all kind of in sequence. And then this might be a terrible phrase, but creative hopelessness is really exploring with the clients what are all their kind of control strategies. What have they done to try to help themselves with whatever problem, and what's really worked? Because workability is the kind of the guiding light in ACT. You want to do what works. So leaps on a stream is another kind of a mindfulness practice where you would ask the patient to ground themselves and sit comfortably and just let thoughts come to them. And as thoughts come to them, just imagine those thoughts um, on a leaf, and they're just floating down the stream. So as you have one thought, it goes on the leaf and it goes away. You have another thought, goes on the leaf and it goes away. And another thought, it goes on a leaf and goes away, etc. Um, that's part of the diffusion, not getting fused with these thoughts, just accepting them as thoughts. Like I just had a thought that I should have done something and just let that float away. Repetition is, this is kind of a classic one where if you just, in this one it's milk, 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 but you can use any word. If you can envision just a glass of milk and it's cold and you can see that it's cold and it looks very inviting if you like milk. And then, you see that thought in your mind and you just start saying milk, 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 over and over and over and repeat it. And pretty soon that image just kind of evaporates and milk doesn't even become important to you anymore. Again, you're going for this diffusion and acceptance. There's more interventions, and of course, this isn't a comprehensive list. This is just to give you kind of a flavor of acceptance and commitment therapy. But values clarification is important, right? And that's different than goals. So, you can kind of deduce values from goals. So if somebody says, my goal is a diet, I got to lose weight. So maybe their value is really to live a healthy life, right? And there's a lot of goals that could be associated with that value of living a healthy life. So clarifying what those values are very important because that's kind of a core principle of ACT, right? You want to, at any decision point, you want to ask yourself, am I moving towards my values or moving away from my values? So obviously you have to know what your values are. And I'm not going to go into details about the others, but you'll be hearing more about these in future trainings. Okay, so in the beginning, we're going to use the OQ45, which is the standard assessment that we use to track progress with our patients, as you know. I think you've all been trained on that already. And then we're going to use the Acceptance and Action Questionnaire, the AAQ2, which is a validated measure used in the ACT community to measure psychological flexibility. So we're going to do these all pre and post therapy. And for trauma, and this might not be the best, but this is what we're going to use the PCL5 just to get some relative scores relative to beginning of treatment and the treatment. And we're going to give them to both groups, the treatment as usual group and then the ACT group as well. And then, of course, at the end of the program, we'll evaluate it, results from the OQ45, the AAQ, and the PCL5, and see if the ACT program, the ACT dose of therapy, produced any different results than the treatment as usual. And then we'll take it from there, right? So it may or may not. It will answer, at least give us a preliminary answer to that original research question. And then we can make a decision from there if we want to proceed with this program and broaden it out, or we want to move on and try something else. So that's to be determined. So these are a list of references I used for this presentation and actually come up with a research question. So ACT has been researched a lot. There's a lot of randomized control studies that validate the benefit of ACT for very varied diagnosis. and certainly for trauma. We're focusing on intergenerational trauma. And then lastly, I did use some AI sources to design the graphics and ChatGPT to format the references in APA7. No other tools were used. So that completes my presentation. And as I said, you will be receiving more training, more specific training on ACT, but hopefully this was a good introduction to the training program and what we're trying to accomplish. So I appreciate your attention and thank you very much.